Alrighty. Hey there, everybody. Welcome to this week's live Facebook training. Hopefully your week's off to a good start. It's Wednesday, so we're at hump day. We're halfway through already. This is exciting. So today we're going to be talking about blood pressure. Obviously, is a huge topic because a lot of people have high blood pressure, and there is such a thing as low blood pressure. But before we get into either of those, we need to understand the basics of what blood pressure is, right? Um, so let's jump into that, and then we'll talk about high blood pressure, and then we'll talk about low blood pressure. So for sake of a simple definition, blood pressure is the force of blood being pushed through your arteries to carry oxygenated blood to other areas of your body. So there's two numbers that measure this. You have the top number, which is the systolic number, and that is measuring the pressure in your arteries when your heart is contracting, versus the bottom number, which is the diastolic number, and that's the measure of pressure in your arteries when your heart is at rest or in between beats, essentially. Um, and blood pressure is measured in millimeters of mercury. And this all started back, obviously, when they were designing blood pressure cuffs initially. The way they did it was actually had mercury, and it would go up a certain amount and all this other stuff. We still use that term today, even though we don't actually really use mercury anymore. Um, and it's important to note before we dive into the different distinctions of what qualifies as normal blood pressure and all of that. They used to have a category called pre-hypertension, and that is no longer part of the terminology when we're talking about blood pressure. The American Heart Association actually did away with that and revised their whole classification system within the past couple of years. And so that's what we use nowadays. So low blood pressure is called hypotension, and high blood pressure is called hypertension, which is why obviously it can get a little bit confusing. But low blood pressure is when your systolic number, or the top number, is anything less than 90, and your diastolic number, the bottom number, is anything less than 60. So we're going to dive more into, obviously, conditions that can cause this and certain things along those lines later on in this session. Normal blood pressure is when your systolic is roughly somewhere around 120 for your systolic, and then your diastolic is somewhere right around 80. Um, and then if your blood pressure can be elevated is if your systolic is somewhere between 120 to 129, and your diastolic is above 80. So this is why, obviously, that means it's slightly higher than normal, but it's not to the point of being hypertension or high blood pressure. And they actually have now broken down hypertension into different stages. So hypertension stage 1 is if your systolic number is 130 to 139, and if your diastolic is between 80 to 89. So if you're hypertension stage 2, which is the next level up, that's when your systolic number is at or greater than 140, and your diastolic is at or greater than 90. So this is obviously, starting to get up at the high end of the range. And the very last stage is the hypertensive crisis. And this is if your systolic is above 180 or your diastolic is above 120. This is usually a medical emergency and needs immediate treatment if your blood pressure, if either of these numbers are high or both numbers are high. And this is why, by having these much more distinct classes, it helps as far as the treatment options. So when it comes to your blood pressure, it's normal for it to fluctuate throughout the day. And it's dependent on body position. Are you laying down? Are you sitting, standing? All of that. It also depends on your breathing, your stress level, your physical condition, your physical activity that you're doing at the moment. Are you running or are you sitting? Any medications you are taking, what you eat or drink, and just in general the time of day. Usually your blood pressure is lower at night and higher, especially when you first wake up in the morning. So when we're talking about high blood pressure, the majority of the time they're focusing on the systolic number, that top number. So this is where you're, looking at when your heart's contracting, the amount of pressure that's being pushed through your arteries. And as you age, and obviously other factors influence this, but everybody as we age, our blood pressure naturally increases. And this happens because of, as we're aging, your body, naturally your arteries start to stiffen, and means they don't contract as well. And then you have long-term buildup of plaque, usually from our diet and things like that. And there's just increased instances of cardiac and vascular diseases. So obviously, there's certain things that you can do to increase or decrease your chances of having issues. However, there's recent studies that show the risk of death from like ischemic, which means lack of blood flow, heart disease, or stroke, doubles for every 20 millimeters of mercury increases in systolic, and or 10 millimeters of mercury increases in diastolic. And this is particularly for people 40 to 89. So this is obviously very important because your blood pressure is a good indicator of how your body is just functioning. And when your blood pressure's high, it's telling you, hey, there's things going on here that you need to get fixed. Problem with high blood pressure is there's really no specific symptoms. So you don't even know that you have it unless you're, diagnosed by going to the doctor's office. Sometimes people might have headaches or shortness of breath or like a nosebleed, but obviously these are non-specific symptoms. So you can have these with any other condition essentially, and it might not be related to your blood pressure. So this is why having regular screenings is key. Blood pressure or high blood pressure is divided into two main types. You've got primary, which is essential hypertension. And this means there's no identifiable cause. And it tends to develop gradually over many years. This is where you start to, as you age, your blood pressure increases. Secondary hypertension is when there's an underlying condition that is causing your blood pressure to be high. Often this appears suddenly, and it will cause higher blood pressure numbers than just primary hypertension. There's various different conditions and medicines that can actually lead to this, such as like obstructive sleep apnea, kidney disease, thyroid problems. Obviously, diabetes is a huge one. When it comes to medications, certain things like birth control pills, cold medicines like over-the-counter cold decongestants, over-the-counter pain relievers, obviously certain prescription medications, obviously illegal drugs like cocaine and amphetamines will increase your blood pressure as well. But when we're looking at risk factors for high blood pressure, the big one is age. And just naturally your blood pressure is going to increase, as we said. But up until about the age of 64, men are more likely to have high blood pressure. After that, it is pretty equal as far as gender differences when it comes to blood pressure. The next big issue is if you are of African American heritage, you are more prone to having blood pressure at an earlier age, and unfortunately are also more prone to having serious complications of this. And obviously there's multiple factors that go into why this is the case. Part of it is that blood pressure issues tend to run in families. Obviously, if you're overweight or obese, that also influences whether you have high blood pressure, because the more weight you have, your body has to pump more blood to more tissues and more oxygen and all of that. So it's having to work harder. The same thing if you're not physically active, because of the fact that your heart has to work harder with each contraction to pump out blood. Your heart's like any muscle in your body. It needs to be conditioned in order to function correctly. And the best way to do that is obviously through exercise or at least some form of physical activity. Also, the lack of physical activity increases your chances of being overweight. So there's a twofold issue with that one. Using tobacco, whether you smoke or chew it, is another big issue because it damages the linings of your artery walls. And also, it's important to note that secondhand smoke also puts you at a greater risk. Probably not as great of a risk as someone who is the actual smoker, but it still increases your chances. If you have too much salt in your diet, salt can cause fluid retention. That means your body retains fluid, and so this will cause you to have high blood pressure. Same thing if you have too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. And so if you don't have enough potassium, you're going to probably have too much salt. So this is why it's important to have a healthy, nutritious, well-balanced diet, because there's so many different factors of our food intake that influence obviously many processes in our body, but especially with your blood pressure. Another big factor is if you drink a lot of alcohol. Excessive consumption of alcohol over time can cause your blood pressure to be elevated. And then huge one in today's society is high levels of stress lead to temporary increases of blood pressure, which obviously when we're trying to avoid certain situations like the whole fight or flight syndrome, that's important. When you have chronic high levels of stress, it will cause your blood pressure to be up all the time. And this is where it gets to be, problematic. And so complications from high blood pressure are incredibly severe. Obviously, you are at increased risk of having a heart attack or stroke. You're at increased risk of having aneurysms, which is when your artery wall actually becomes weakened and part of it will balloon outward. This indicates this area is weak enough that it could actually rupture and cause internal bleeding. Obviously, life-threatening emergency in that situation. Also, high blood pressure puts you at risk for heart failure. Because your heart's having to work harder, it will cause the left ventricle, the bottom part of your heart, the main chamber that pumps blood throughout your body, to thicken and enlarge. And this means that over time, it functions less and less well. In addition to, obviously, just in general, your cardiovascular system not functioning well, certain parts of it will also not function, such as those that go to your kidneys. So you can end up with kidney failure. It also affects the blood vessels that go to your eyes, so you can have vision loss. You can end up with metabolic syndrome, which is a group of disorders surrounding your body's metabolism, which involve your waist size, your triglyceride level, your decreased levels of your good cholesterol, the HDL cholesterol, increased levels of your bad cholesterol, the LDL, and obviously high insulin levels, which put you at risk for diabetes and all these other things. High blood pressure can also impact your memory, because obviously you get blood vessels within your brain. And so it's when you have issues with your blood vessels throughout your body, it's not just one particular area. It just doesn't stay focused on your heart. It's every blood vessel, essentially. So this is where you can end up with, obviously, having memory issues. It also increases your chances of having dementia. So as you can see, blood pressure is a huge, huge factor in your overall health. So if your blood pressure is high, it can be very problematic because it can lead to a bunch of other serious issues. So in order to diagnose it, though, this is where it's usually going to take several visits to your doctor because obviously, as we talked about, your blood pressure varies throughout the day. So when you go to the doctor, maybe you've just eaten a meal, or maybe you were in a hurry to get to the doctor, or something happened and you were stressed out. Or if you're like many people, you have white coat syndrome, which means your blood pressure is just naturally higher when you're in a doctor's office or a hospital type setting. So before a doctor can diagnose you with high blood pressure, they're going to have to repeatedly check it over multiple visits. And they might ask you to monitor your blood pressure at home, which is, important to do anyway if you're concerned about your blood pressure. And the good news is there's many different devices that are available for this. Just keep in mind it's not a substitute for going to your doctor's office to get it checked. And you want to make sure that your cuff is accurate. So at least once a year, bring it with you to your doctor's office appointment and, check it versus what they have as far as your blood pressure goes. And it's important to note that the American Heart Association does not recommend using the blood pressure cuffs that check your wrist or your finger, because they're not as accurate and don't give as reliable results as the one that's actually on your arm. So if you are diagnosed with high blood pressure, next big question is, well, how do you treat it or manage it, right? And so this obviously, the goal of managing it or treating it really depends on your age and your health conditions. And your doctor is going to help you determine what you should be doing for this. The most important step are lifestyle changes. And this is also a way to prevent hypertension, so we're going to get to this in just a little bit here. But if lifestyle changes aren't enough to improve your blood pressure, your doctor is going to prescribe some form of medication. And since our body is regulated by multiple different processes as far as our blood pressure, there's very, very many different classes of blood pressure medications. And so we're going to go over a brief overview of them here. This is by far no not an in-depth description of all of these. It's just to give you an idea of what options there are. So the first one, that's the most common one that is tried, are diuretics or water pills. And these help your kidneys to eliminate sodium and water from your body. There's many different classes of these, which can be like thiazide diuretics, loop diuretics, or potassium-sparing diuretics. And the most common ones are chlorothiazide or hydrochlorothiazide. And obviously, a common side effect of diuretics is that you're going to have to urinate a lot. Which the concern with this is because as your body's getting rid of urine and sodium and all that, you're going to lose potassium as well, which obviously your body needs potassium to function. So if that's the case, your doctor might try potassium-sparing diuretics, which are triametrine or spironolactone. There's a couple examples. So these here usually, as I said, are the first line of defense, if you will, of trying to get your blood pressure down. This next category is angiotensin converting enzyme inhibitors, or ACE inhibitors. And these are designed to help your blood vessels relax by blocking the formation of natural chemicals that narrows blood vessels. And examples of these are like lisinopril, benazepril, or catepril. Big side effect with these is it can cause your tongue to swell, which if that's the case, then you're going to need to be taken off these because obviously you need to be able to breathe, and your tongue can actually swell to the point it can cut off your airway. So if that happens, your doctor will switch you off one of these to one of the other categories. Another option is angiotensin II receptor blockers, or ARBs, ARBs. And these relax your blood vessels by blocking the action, not the formation, of the natural chemicals that narrow your blood vessels. So it sort of functions similarly to the ACE inhibitors, but it's a little bit different. Some examples of these are candesartan and losartan. Then you have calcium channel blockers, which relax the muscles of your blood vessels. And in some cases, they can also slow your heart rate. And so examples of these are amlodipine and ditalazim. They often work better for older people and people who are of African American heritage than trying like an ACE inhibitor by itself. The big thing with these, though, is don't drink or eat grapefruit products, because these can actually increase your blood levels of certain calcium channel blockers, which can be dangerous, obviously. If you have any concerns about that, definitely talk to your doctor if you're on a calcium channel blocker. Sometimes these are the main classes right there that we just discussed: the diuretics, the ACE inhibitors, the ARBs, and the calcium channel blockers. Sometimes, though, these are not effective by themselves, so your doctors might try something else, because there's a bunch of other secondary class of medications to treat blood pressure. You have alpha blockers, which reduce nerve signals to the blood vessels, which lowers the effects of natural chemicals that narrow the blood vessels. Once again, it's all about keeping those natural chemicals in check in some form. In this case, we're talking about, manipulating the nerve signals. So you have doxyzocin or prazosin, which are examples of these. Then you have beta blockers, which reduce the workload of your heart and widen your blood vessels, which causes your heart to beat slower and with less force, which can be important if you have, obviously, enlarged heart. You just have to be careful with them. So you have acebutol or atenolol, which are examples of this. And these are most effective when they're combined with other blood pressure medicines. The next group is alpha-beta blockers, which block the nerve signals to the blood vessels and slows the heart rate to reduce the amount of blood that is pumped through the vessels. So this is sort of a combo of the alpha blockers and the beta blockers all in one pill, essentially. Examples of these would be like carvedilol or labetalol. So your doctor might prescribe this if he or she feels that you need both an alpha blocker and a beta blocker. This just means that hopefully you're having to take one less pill, and it's better managed by having them combined. The next group is Alderstone antagonists, which block the effect of the natural chemicals that can lead to salt and fluid buildup within your body. So this class is also technically considered a diuretic as well, because it sort of functions as that as well as in addition to affecting the chemicals within your body. So examples of these would be spironolactone or alpurone. And they also might be used to treat resistant hypertension, which we're going to talk about in just a moment, so hold tight on that one. We've only got a couple more classes of antihypertensives to talk about. So renin inhibitors slow the production of renin, which is an enzyme that's produced by your kidneys that starts the chemical chain process that will increase your blood pressure. The main drug that's in this class is Elskrin, and this shouldn't be taken with any ACE inhibitors or ARBs because it can increase your chances of having a stroke. So this here is more along the lines of your doctor's thinking that it's something to do with your kidneys that's causing your blood pressure to be high. They'll probably put you on something like this. Vasodilators work directly on the muscle walls of your arteries, so it prevents them from tightening and narrowing. Some examples of this are hydralazine and minoxidil. Then the last one is the central acting agents that prevent your brain from telling your nervous system to increase your heart rate and narrow your blood vessels. So some examples of this are clonidine, guanfacine, and methyladopa. Obviously, that's a lot of information right there. You don't really probably need to know these unless you have high blood pressure and your doctor's trying to you on different medicines. Some key things to remember if you are on medicine for blood pressure is always take it as prescribed. Never skip a dose or abruptly stop taking your medicine because it can cause rebound hypertension, which means your blood pressure actually goes up higher than it was before you even started taking the medicine, which obviously can put you in a life-threatening situation. So if for some reason you're having trouble remembering to take your pills, if you can't afford your pills, if there's side effects that you just don't like, talk to your doctor about switching your medicine, but don't stop taking it until you do, because otherwise you can have serious complications. So as far as resistant hypertension, this is when your blood pressure remains high, despite taking at least 3 different types of blood pressure medication, and one of those is usually a diuretic. So if this is the case, your doctor's probably going to start trying to investigate what is actually causing your blood pressure to be high, because usually it's an indication that something within your body is causing your blood pressure to be elevated, and if you can correct that, then your blood pressure should come down. So that's the main concern. Your doctor's going to probably need to adjust medication, and they're going to need to look at what you're taking as far as other prescriptions or other conditions, anything you're taking over the counter that you're purchasing. So it just needs a little bit more investigative work to get it down, but it does mean that for some reason your blood pressure is remaining high despite being on medicine. So the next big thing we're going to talk about is, as far as treatment goes, but it's also the prevention for high blood pressure, is lifestyle changes. And these are the things your doctor is usually going to recommend before they put you on medication, or if they're concerned that you could develop high blood pressure. But it's also things that you can start doing now, even if you're not at risk for blood pressure issues, to help prevent it in the future. The key, most important factor out of all of this is maintaining a healthy weight. And there are several ways to be able to do this. Obviously, eating a healthy diet that is low in salt, low in fat, meaning saturated fat and total fat, and cholesterol. And obviously, you want it low in added sugars and just natural sugars in general. But you want it high in fruit, vegetables, and low-fat dairy products and lean-type meat products, or other protein sources like beans and legumes. And then the next big factor in this is getting plenty of activity and physical exercise. So obviously just being more active in general in your everyday life is key. So, take the stairs instead of the elevator, park further out at the grocery store so you got to walk in and walk out. But you should also aim for about 30 minutes of aerobic exercise most days of the week. And if you don't have 30 minutes all grouped together, try splitting it up into 3 separate 10-minute intervals. The key thing is that you have to make sure you get your heart rate up. And it's important to note that if you're just starting a fitness routine, brisk walking counts. So you just got to make sure that you're actually, moving and for the whole duration. If it's 10 minutes, move for those 10 minutes, or if you can get into 30 minutes, move for those full 30 minutes. That's the important factor. And then as far as obviously don't smoke and limit the amount of alcohol you drink. Men should consume fewer than 2 alcoholic beverages a day, and women should consume less than 1 alcoholic beverage per day. And when we're talking about like a standard drink size, this is where often it can get confusing depending on obviously what type of alcohol you prefer. One standard drink equals either 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of like the 80 proof or hard liquor. So you want to make sure that obviously if you do drink, do so in moderation. Try not to obviously go over these numbers on a regular basis, and that's key. But these 3 factors, as far as eating healthy, getting plenty of exercise and activity, and then not smoking and moderate alcohol intake are huge in being able to help you maintain that healthy weight. That's going to help you, prevent high blood pressure from occurring. Or manage it. So by implementing these, you should see improvements if you have high blood pressure. And if you don't have high blood pressure, then you're doing your part to prevent it. So in summary, that's pretty much high blood pressure in a nutshell. I know it was a little bit long, but it's so prevalent within our society that I felt it was deserved that length of in-depth discussion. Obviously, if you have questions, comments about it, feel free to put them below, message me. I would be happy to go into even more detail on that. Now we're going to switch over and we're going to talk about hypotension, which is low blood pressure, which obviously is the different end of the spectrum, and it can be problematic. It's not as problematic because it doesn't happen as often as high blood pressure, but for someone who has low blood pressure, if they're an athlete or something along those lines, then what's normal for them might be really low blood pressure for someone else. So typically, most doctors don't consider blood pressure too low unless it causes symptoms. And unlike high blood pressure, with low blood pressure, there are symptoms, but this is usually accompanied by a sudden drop in blood pressure. It's not for someone who's in good shape and their blood pressure is normally chronically lower. This is for some reason if it just drops all of a sudden. And so the symptoms can include like dizziness or lightheadedness, blurry or like fading vision, fainting, nausea, fatigue, lack of concentration, or shock. Certain conditions that lead to shock within the body can cause low blood pressure. Extreme hypotension, which is when it drops really low, really quickly, it is actually a life-threatening condition, so it does need to be treated immediately. And this is more in line with the whole shock concept. And symptoms of this can be confusion. This is especially true for older adults. Cold, clammy, pale skin, rapid, shallow breathing, and a weak, rapid pulse. So obviously, you or most likely you'll come across someone who looks like this, has these symptoms. They need immediate medical treatment. They need to go to the hospital. But low blood pressure is actually broken down into categories depending on cause and other factors. The primary low blood pressure condition is called orthostatic or postural hypotension. And what this means is that your blood pressure drops when you stand up or from a seated or lying position. And the reason this happens is gravity causes your blood to pool to your legs when you stand. Normally, your body can compensate for this by increasing your heart rate and constricting blood vessels. Unfortunately, people with orthostatic hypotension, this mechanism fails. So their body doesn't do that. So all of a sudden, when they stand up, their blood rushes to their legs, which leaves their head and their upper part of their body, making them more prone to pass out and some of the other symptoms that we mentioned earlier. So for instance, if you've ever stood up too fast, and you get that weird head rush feeling and you feel like you're going through like tunnel vision, that's sort of an example of orthostatic hypotension. Certain things can cause this, like dehydration, prolonged bed rest, if you're in bed for a long period of time and then you go to get up, pregnancy, obviously you're Cardiovascular system changes when you're pregnant, so it makes you more prone to having this. Diabetes can increase your chances. Obviously, having heart problems, burns, like if you have extensive burns on your body, if it's extremely hot outside and you've been outside, having large varicose veins in your legs, and certain neurological disorders can also do this. In addition to having medical conditions that can cause it, certain medications can cause it as well. Particularly, obviously, if you're on medicine to treat high blood pressure, you're more likely to have orthostatic hypotension. You're more likely to have this, where your blood pressure drops suddenly when you stand. Also, medicines like antidepressants or medicines used to treat Parkinson's disease also increase your chances of having this. But it's also especially common in older adults, just because of the way your cardiovascular system changes as you age. The next category of low blood pressure is if you get low blood pressure after eating, and this is postprandial hypotension. And usually it occurs about 1 to 2 hours after you eat, and it's more often seen in older adults. The reason it happens is because once you eat, your body sends blood to your digestive system to help you digest food. And so that means it's less available for other parts of your body to use. So when you stand up or something along those lines, your body doesn't have the blood it needs to get to your legs, if you will, and the rest of your body because it's sent all the blood to your stomach, essentially. So very similar to orthostatic hypotension. This here is your body's normal mechanism is to constrict blood vessels and increase your heart rate to prevent this. Unfortunately, once again, this mechanism fails in this situation. So people who are more likely to experience this are anyone with high blood pressure, or if you have like an autonomic nervous system disorder, such as Parkinson's disease. A way to help prevent this is to eat smaller, low carbohydrate type meals more frequently. That way you prevent your body from sending as much blood to your digestive system. It's also important to drink plenty of water, as water increases volume within our body, which will also keep your blood pressure higher. And also avoid alcohol, because alcohol obviously lowers your blood pressure. So you definitely want to avoid that as well. So the next category is low blood pressure from faulty brain signals, or neurally mediated hypotension. And what this is that if you're standing for a long period of time, your blood pressure drops. And this type usually affects younger adults and children more often than not. And it's usually seems to be the result of like a miscommunication in nerve signals between the heart and the brain, so which causes the blood pressure to drop. The next category is the low blood pressure due to nervous system damage. So this is like multiple system atrophy with orthostatic hypotension. I know this very long technical name. So it's also called Streiger syndrome. And it's a rare disorder. It's usually seen with, has like Parkinson's type symptoms, and it causes progressive damage to the autonomic nervous system. And your autonomic nervous system, its whole function is to control involuntary things that our body does, like blood pressure, heart rate, breathing, digestion. It's the stuff we don't think about. So basically our autonomic nervous system is functioning in the background, doing everything that we need it to, so that way we can function. So this particular condition is associated with having very high blood pressure when lying down. So therefore, when you stand up, your blood pressure just drops, and that's where you end up having symptoms of passing out or such. And then obviously certain medical conditions can cause low blood pressure, such as pregnancy. As I mentioned, your whole cardiovascular system changes because obviously you're growing a baby inside you, so your body needs to support that. Typically, once you deliver the baby, your blood pressure will return to normal. Obviously, if you have heart problems, like a low heart rate, heart valve problems, had a heart attack or heart failure, this can also increase your chances of having low blood pressure. Endocrine problems, which that could be like parathyroid disease, adrenal insufficiency, low blood sugar, stuff like that that affect your endocrine system can impact your blood pressure as well. If you're dehydrated, because your body needs fluid, as I mentioned just a minute ago, with more water you take in, then the more fluid volume you have overall within your body, and this helps it just function better overall, but it also impacts your blood pressure significantly. If you have any form of blood loss from an injury, this will obviously impact your blood pressure because you're losing blood volume. If you have a severe type of infection called septicemia, which is when the infection enters the body and goes into your bloodstream and then travels throughout your body. This obviously can impact your blood pressure. If you have severe allergic reactions like anaphylaxis, where you have trouble breathing and all of that, that can cause dangerous drops in blood pressure as well. Another one is the lack of nutrients in your diet. If you don't have vitamin B12, folate, and iron, then your body has difficulty producing red blood cells, which obviously that carries oxygen throughout your body. You can end up with anemia, and this can cause low blood pressure as well. Certain medications obviously can cause low blood pressure. And any of the medicines we talked about for high blood pressure, such as diuretics, alpha blockers, beta blockers, those right there can definitely cause low blood pressure. If you're on medicines for Parkinson's disease, certain antidepressants, and certain drugs for erectile dysfunction, which is why they always recommend being careful if you're using those and you're on blood pressure medicine. Definitely talk to your doctor first. So obviously one big risk factor is age. As you get older, you're more likely to have issues with orthostatic hypotension because your blood pressure is going to drop when you stand up and all of that. So you want to be careful with that as well. And then obviously if you're on certain medicines or if you have certain diseases, this also increases your chances. The biggest complication with low blood pressure is obviously if you get dizzy, weak, and faint, then you're at risk for injuries from falling. So that's the main concern, is you could end up getting significantly injured from falling due to passing out because of your low blood pressure. Unfortunately, if your blood pressure gets severely low, it can actually deprive your body of oxygen. So this can lead to damaging to your heart and brain. The treatment for low blood pressure is really dependent on the symptoms you have. If they're mild symptoms, you don't really need treatment. Your body will compensate up to a certain point. If you have, severe symptoms, that's when your doctor is going to start looking at medication. If they think it's medication related, they will have to change the medicine that you're on to see, or lower the dose or something along those lines, just to see if they can get it better. And if there's no clear cause, then the goal is to raise your blood pressure and reduce symptoms. And there's a couple of ways to do this. Obviously, you can incorporate more salt into your diet. Your doctor will help you determine how much more, because you don't want to go overboard, because you can end up with heart failure and other problems with having too much sodium in your diet. But if you have chronically low blood pressure, increasing your salt intake will increase your blood pressure. As we've talked about a couple of times now, drink plenty of fluid. Fluid volume, like water, will help increase your blood pressure. So definitely stay hydrated. Compression stockings, those are great because those you wear on your calves, your lower legs. What they help do is push your blood back up. They help, essentially, they're assisting your cardiovascular system in getting the blood back to your heart. So it should prevent you from having that drop in blood pressure because your blood's actually going back up to your heart. Obviously, there's actually medications that are available to treat high blood pressure, particularly orthostatic hypotension. You have fludrocortisone and Minidrin that are used. It depends on what your doctor thinks is going on as far as which one they'll put you on. But essentially, they work by restricting the ability of your blood vessels to expand. So this increases your blood pressure. And when it comes to things you can do at home, obviously drink less alcohol, because obviously this lowers your blood pressure. And plus, it's a dehydrating beverage. So it's going to make you more prone to being dehydrated. So you don't want to have alcohol as if you have low blood pressure issues. And then pay attention to your body position. So if you're squatting or sitting or laying down, gently move to a standing position. Don't rapidly move to one. Don't sit with your legs crossed because this disrupts your blood flow. And if you do start to feel symptoms coming on, like you're lightheaded, your vision gets blurry, something like that, and you're standing, cross your legs and squeeze them together. Or you can put one foot up on a chair or a ledge and lean forward. What this does, either of these do, is helps to promote blood flow returning back to your heart. So hopefully it'll prevent you from passing out. And then, as we were talking about before, definitely eat smaller, low-carb meals more frequently, because this will help you, prevent the postprandial hypotension. And your doctor might also recommend drinking caffeine, like 1 or 2 strong cups of tea or coffee in the morning. The key thing is you don't want to continue to drink any caffeinated products throughout the day, because this means your body becomes less sensitive to the caffeine, and therefore it won't work as effectively. Plus, caffeine, similar to alcohol, will dehydrate you as well. And then you still want to exercise regularly, because that raises your heart rate. And if you're doing cardio, you want about 30 to 60 minutes of exercise a day that raises your heart rate. And you also want to do resistance exercises about 2 to 3 days a week. This just keeps your cardiovascular system functioning well overall. When you're doing strength training exercises, it helps promote muscle movement. Muscle movement helps actually contract blood vessels and push blood back up. So this is especially important. The key thing is avoiding exercise in hot, humid conditions, because obviously this can impact your blood pressure. So that's pretty much low blood pressure, hypotension in a nutshell. I know this video is a little bit longer than most, but blood pressure is such a huge, important issue that I just wanted to make sure did it justice in covering it all. If you have questions or comments about either hypertension, hypotension, or anything else related to blood pressure, please put them below. Or you can message me. I'd love to hear from you guys. But otherwise, thank you for joining me today and sticking around for the long video here. But until next week, stay healthy, and hopefully you guys have a good rest of your week.